Lack of sleep strains your health and your performance, but it also can strain your relationships, and a lot of us are suffering. Dr. Chris Hammond is a neurologist at the Ogden Clinic. He's joining me to talk about some of the medical causes contributing to poor sleep and how you can end those sleepless nights. Let's put it into numbers if we can, Doctor. How many of us are tossing and turning at night and struggling to sleep?
Over 50% of people will complain of insomnia at some point in their lives. Now, insomnia, we use that as a very generalized term. Insomnia can reflect many problems, so that's really up to physicians, your care provider, to determine what's causing your sleep disruption. And that's the point I want to make today, is sleep deprivation and its consequences. Sleep deprivation can be from primary insomnia, but there's also many other sleep problems. Obstructive sleep apnea, restless leg syndrome, circadian dysfunction. There are a whole host of many others, but of course we want to focus on a few. But in the clinic we can examine what's causing insomnia or sleep deprivation in general. And so yes, there are many problems with sleep. We know that.
Yeah.
The example I like to make is all of us know how we feel the next day when we don't get a good night's sleep. Especially recognized at work, we may not perform as well, or not able to multitask as well as we normally do. You can take that, you can take those examples and equate that into your home environment, or any relationship for that matter. Of course, our interpersonal skills are affected as a consequence to sleep deprivation. There's many physiological explanations for that. For example, if you're not able to get a good night's sleep, our cognitive performance is going to be affected by as a consequence, poor attention.
Right, right. It all kind of can be a ripple effect from that one bad night of rest or lack of rest.
Well, absolutely.
You've brought the mask here, which I know indicates the sleep apnea, which you touched on. How often are these sleep problems related to sleep apnea?
Very common. We know sleep apnea is experienced in about almost a quarter of the population.
Really?
And it can be very subtle. Quite often recognized by the bed partner can be the first indication that this person is suffering from sleep apnea. For example, snoring and witness apneas is what we call, meaning a person sees their bed partner stop breathing.
Well, let me ask you this. How can you be tested to know if sleep apnea is really your issue?
Well, if you do have those symptoms, or you feel tired in the daytime, those can be related to your physician, and that can be examined further from a standardized sleep test. It can be a home sleep test or in a lab or office somewhere.
And from your experience, if once someone has been diagnosed and they're working through the treatment options, what are the results? Can they really sleep better and as a result live better? As
a matter of fact, yes. So we have the more immediate effects of treated sleep apnea, which can include obviously more heightened awareness, cognition, less fatigue. We're able to multitask, we're able to function much better on the more personal level. And so those communication skills are obviously improved. But we also understand long-term benefits of treated sleep apnea, because we know untreated sleep apnea will lead to potentially high blood pressure, diabetes, stroke, and many forms of heart disease. All serious conditions, so definitely something to pay attention to and take note of. Thank you so much for the overview today. We'll let you know if you want more information or if you would like to schedule a consultation, you can go to ogdenclinic.com so you can start getting your best sleep too. And we'll be right back.